Hello, my name is Leah Christie and I'm a student nurse at the University of South Alabama, and today I'll be performing the medication administration checkoff. So now I'm going to scan my room. First, I'm going to make sure that I'm in a no interruption zone, so I'm going to close the door to the medication room. I'm not going to answer any calls, and I'm going to limit conversation with colleagues. And then I'm going to check the patient care order form and the MAR for the 5 rights of accuracy. So I see the right patient, Jaguar Jones, the right drug, heparin, the right dose, 5,000 units, the right route, subcutaneously, and the right time, every 12 hours and every 12 hours. And I check for the allergies, which is penicillin and penicillin. So next I'm going to perform hand hygiene, and I'm going to select my right medication. So I select the heparin, and I see that it is also heparin on the MAR, and that the expiration date is 12/5/2025, so it's not expired. I'm going to show you. And then I see that it is subcutaneously, so I'm going to grab the TB syringe, which is 1 milliliter. And then I'm going to check the time, and I see that it has not been given in the past 12 hours like the MAR says. And then I'm going to do my calculations. So I see that it is heparin, 10,000 units per milliliter. So since the dose is 5,000 units, I would do 0.5 milliliters in the syringe. And then I'm going to clean the vial with an alcohol-based prep. And then I'm going to take my TB syringe, and I'm going to uncap it, and I'm going to draw up 0.5 milliliters of air. And then I'm going to inject in the vial, and I'm going to release the air. And then I'm going to turn this upside down. And I'm going to take up 0.5 milliliters, or a little bit more than that, of the heparin. And then I'm going to flick out the bubbles and release any excess to make sure that it's exactly 0.5 milliliters. And then I'm going to recap using the scoop method. And I'm going to show you my syringe. So now I'm going to check on the MAR for the accuracy, and I see that it is heparin and heparin, 5,000 units or 0.5 milliliters and 0.5 milliliters subcutaneously TB syringe, and then every 12 hours, and it has not been given in the past 12 hours. So now I'm going to put this back in here and have a nurse check my calculations to make sure that they are correct. And then I'm going to do the second check of accuracy, and I'm going to make sure that it is the heparin of 5,000 units or 0.5 milliliters and 0.5 milliliters subcutaneously for the TB syringe, and then every 12 hours, and it is not been given in the last 12 hours. So I'm going to grab my MAR and my syringe and set it aside to bring to the patient's room. But before I do that, I'm going to make a label for the syringe. So I'm going to take a piece of tape and I'm going to write the patient's name, Jaguar Jones, the drug, heparin, the dose, 5,000 units, and I'm gonna initial it. And then I'm gonna put the tape and place it on the syringe. And I'm gonna bring this and the MAR to the patient's room, and upon entering, I'm going to perform hand hygiene, and then I'm going to identify the patient using 2 identifiers. So I'm gonna use his armband and the MAR. So I see that it is Jaguar Jones. Jaguar Jones, and date of birth is 08/25/1963. 08/25/1963. And I see that his allergies are penicillin, and allergy is penicillin. I'm going to ask him if he is allergic to anything else and what his reactions are. And then I'm going to perform the necessary pre-administration assessments for the right medication. And then I'm going to do the 3rd check of accuracy. So I see that it is Jaguar Jones and Jaguar Jones on the label. And then I see that it is heparin, 5,000 units, 5,000 units, subcutaneously every 12 hours, and it's not been given in the last 12 hours. And then I'm going to explain the procedure to the patient, and I'm going to let him know when I'm about to inject. And then I'm going to raise the bed to a working height and lower the side rail. And then I'm going to apply my goggles and my clean gloves. And then I'm going to assess the abdominal area. So I'm going to go 2 inches away, all the way around from the umbilicus, and I don't want to go above the intercostal margin or below the pubic region, and I also don't want to go past the anterior superior iliac spine on either side. And then I'm going to check for any bruising or skin integrity, and I don't see any. So now I'm going to clean my injection site with an alcohol rub. I'm going to do this in a circular motion, and then I'm going to leave the alcohol rub pointing at the clean area and let it dry. And then I'm going to uncap my syringe and put it in the sharps container, and then I'm going to push up 2 inches of skin and go at a 90-degree angle. If I wasn't allowed to push up 2 inches of skin, I would do a 45-degree angle. So I'm gonna do the 90-degree angle, and then I'm going to inject the medicine and pull out and apply gentle pressure and put my syringe in the sharps container. And then I'm going to take off, and then I'm going to reposition the patient to a comfortable position, and I'm going to lower the bed and raise the side rail, and then I'm going to take off my gloves and my goggles, and I'm going to perform hand hygiene. And then I'm going to assess the patient for any allergic reactions, and then I'm going to document the procedure on the MAR, which is the 6th right, and then I'm going to come back at a later time to reassess the patient to make sure that he didn't have any allergic reactions.